This is the second module of a series of modules that were developed for a project funded by a Knowledge Research Event Grant from the Canadian Institutes of Health Research. Both Cochrane Canada and the Dietitians of Canada saw it as a great opportunity to encourage and train dietitians to be involved with the production of systematic reviews published by the Cochrane collaboration. We would also like to acknowledge the support and feedback from our project working group, the many dietitians across Canada who volunteered their time and expertise, and the many Cochrane review groups and centres who are also excited about this great opportunity. There are 3 modules which provide basic and more advanced training on how you, as a dietitian, can provide feedback about Cochrane systematic reviews before they are published. The first module provided an introduction to Cochrane systematic reviews and why peer review is important. This second module will describe how you can provide peer review or feedback. And the third module will offer more information about the statistics typically used in systematic reviews. Some of you may already have experience providing peer review for articles in other journals. These modules will explain the process in Cochrane and some of the important methods in Cochrane reviews. If you have never provided peer review, but have some expertise in an area of nutrition or are working as a dietitian, these modules should provide a good basis as well as more advanced information to prepare you to peer review Cochrane systematic reviews. This second module, How to Provide Peer Review for Protocols and Reviews, will take you through the steps of peer reviewing a Cochrane protocol and a Cochrane systematic review. By the end of the module, you will have the basic knowledge to get involved with peer reviewing in Cochrane, and you will be prepared to move on to the third and final module in this series. Specifically, this module will cover the peer review process, peer reviewing a protocol, taking a look at the PICO, methods, and examples, peer reviewing a review, again looking at assessing the quality, believable results, and presenting results, and finally, how to become a peer reviewer in Cochrane. You may recall from the first module that introduced Cochrane systematic reviews and peer review that peer reviewing in Cochrane is different than providing peer review for journals. In other journals, an author submits an article to a journal, and peer reviewers decide whether to reject or accept the article for publication. In Cochrane, authors are supported throughout the whole process, from deciding on an idea for a systematic review to publishing the systematic review. Peer review is provided before authors start a review, at the protocol stage when developing their plan for their systematic review, and during the review process before it is published. Remember, the goal in Cochrane is to publish almost all reviews submitted. Cochrane very rarely rejects a review, as all efforts are focused on helping authors publish their review, from providing training to providing constructive feedback about how to improve the review. It is very important that feedback comes from peer reviewers. Healthcare professionals that are involved in practicing their discipline every day often have very good insight on how evidence can be applied. Their lens through which they recommend and evaluate treatment options may be different than that of researchers. This is why your feedback as a peer reviewer is essential. What is the peer review process, and how does it all start? Once you contact a review group within the Cochrane collaboration, they will put you on their list of peer reviewers to contact when an author has a nutritional-related topic. Typically, the Cochrane review group will contact you a few times a year. If you say yes, you will typically be given a few weeks to make comments. The review group will send you the draft protocol or a draft of the systematic review. Some groups will also provide you with a peer review checklist, which includes questions for you to answer. For example, is the review well written? Other groups will not have a checklist and will simply ask you to provide comments. In either case, there are a few key issues you should consider. We will spend the rest of the module describing these key issues and help you prepare to provide those comments. Since you may be contacted at any time to provide peer review for a draft protocol or a draft systematic review, we will first describe how to peer review a draft protocol for a systematic review. In general, it should take about 2 hours to peer review a protocol. We will start before the draft protocol is sent to you. Initially, the author has an idea for a systematic review. For example, what are the effects of garlic in people with diabetes? She or he contacts the Cochrane review group and the idea is approved. The author then works on a plan or protocol to conduct the review. At this point, the Cochrane review group wants to know whether it's a solid plan and whether the author has missed anything. This is the point when the review group will contact you to peer review the protocol. So what does a protocol look like? All protocols for a systematic review in Cochrane are formatted in a standard way. There is no deviation from this format. A protocol will include a background section which is similar to any paper. It should describe the condition or disease, the treatment, and the importance of the review. Then there is the objective section, which is usually brief. The most important part of the protocol is the methods section. This section describes quite thoroughly what the research question is, how the authors will search for the studies, how they will assess the studies, and how they will do the statistical analysis. It is important that these methods are laid out clearly so the authors cannot change what they are doing halfway through their systematic review because of the results they find. For example, Cochrane does not want an author to think that they will collect data on quality of life and then decide not to because they found that quality of life didn't improve. The authors must be transparent and document that they will look at quality of life and then do it regardless of what they find. Now that you have a basic understanding, how do you start? Let's take the example of the protocol for garlic for diabetes mellitus. Now take a minute to think. What questions do you have? What answers do you want? These may be some of the questions you had and the answers you would want from a systematic review about garlic for diabetes. And likely the questions you have will be similar to the questions that other dietitians might have. For example, is this review about people with type 1 or type 2 diabetes? Controlled with medication or not? Seniors, adults, or children? Will this look for studies of garlic supplements, garlic oil, adding garlic to food? Will studies compare garlic to no garlic or other herbs or other medications? I want to know about its effects on blood sugars, quality of life, complications, and side effects in the short term and long term. Some of you may recognize the types of questions you asked. They usually fall into certain categories. Usually questions fall into the format of PICO: population, intervention, comparison, and outcomes. You can see the first set of questions is about the population that the systematic review will include, such as type of diabetes, type of people involved in the intervention, such as children, adults, or more senior adults. The second set of questions is about the type of intervention or treatment. Will it look at how garlic is provided, such as in garlic supplements, garlic oil, or adding garlic to food? It may also look at what dose of garlic is used and the frequency or how often it is used or given. The C in PICO refers to the comparison of treatments. Will studies compare garlic to no garlic or garlic to other herbs? Finally, we look at the outcomes of the intervention. Will consuming garlic have an effect on diabetes in the short or long term? What other effects might using garlic have? Some examples would be, does garlic lower blood sugar levels? Does it change the quality of life? Are there any side effects or complications from this treatment? In Cochrane systematic reviews, the authors have to be clear about what their PICO is before they start the review. It is similar to the inclusion and exclusion criteria for people in a study. Again, for a systematic review, the authors should go through each of the categories: patients, interventions, comparisons, and outcomes, and describe what they will include and what they will exclude. It's up to you as a peer reviewer to determine if what the authors are including in the review is important. Overall, it should be an important question that asks about the right population, includes the interventions commonly used in practice, and collects information about outcomes that are important to patients and clinicians. It's up to you, the peer reviewer, to say whether this question, the PICO, is relevant to you and your practice, your patients, and your colleagues. Let's look closely at the garlic protocol. When peer reviewing, you would look at all of the PICO criteria to determine if the authors have addressed the right PICO. But let's look at the outcomes section as an example. In the protocol for the garlic and diabetes systematic review, the authors did write quite a long list of outcomes for which they will collect data. The main outcomes that they will focus on are the primary outcomes. They will collect data on mortality, complications, and glycemic control. You would ask yourself, are these the most important primary outcomes that I would want to know about? I would say yes. The authors then gather data about the secondary outcomes measured during certain time periods. They will measure quality of life, changes in adiposity, hypoglycemia, hospitalization, costs, and adverse effects. Do these cover the outcomes you think are important? Maybe these are not as important as the primary outcomes, but they should still be collected? Or do you think some of the secondary outcomes should be primary outcomes, or vice versa? I might think quality of life is important. Are there any outcomes missing? In this case, I wondered why the authors were not measuring whether people with diabetes were able to reduce their insulin or oral medications when taking garlic. This outcome was not listed by the authors, so I will comment on this. The authors have included outcomes that are important to patients. However, it would be interesting and helpful to know whether patients who eat garlic will be able to decrease or eliminate their need for medications to control their blood sugars. You will also need to review other parts of the protocol. You should provide comments about the background section. For example, in the background section, you should ask yourself, did they describe the issue and intervention? And why is it important to do the review? Is there controversy? In looking at the objectives, did they address the PICO? In the methods section, will they search for articles in the literature using keywords that are commonly used in practice? And in the results and discussion, are there results? Or in fact, are there no results yet? So overall, is it well written and clear? Here's another example of how you can provide feedback about the methods section. In particular, this is about the literature search strategy, which should be very systematic and comprehensive. Using the garlic protocol again, you know that the proposed active ingredient in garlic is allicin. The authors should search for this word in the medical databases. You double-check to make sure the authors have included this word in their search strategy. They have. Your peer review comments might read something like, the search strategy looks comprehensive, has used many of the common words that are used by patients and also the words for the active ingredients in garlic. Once you have made your comments, exactly what happens? Your comments are pulled together with other comments from the coordinating editor of the review group, the content editor and statistical editor of the review group, external peer reviewers, at least 2 of them, and you would be one of them. Feedback is provided anonymously to authors. Authors then revise the protocol based on comments. The protocol is then published in the Cochrane Library, and the authors start conducting the systematic review. Next, we will discuss how to peer review a draft systematic review. It can take between 3 and 6 hours to peer review a systematic review. The time mainly depends on the length of the review and how well done the initial draft is, as well as the amount of time you have to dedicate to the peer review itself. So, as with protocols, the authors write and submit the draft systematic review to the Cochrane Review Group. The review group then will contact peer reviewers to provide comments. The usual amount of time provided by the review group to you as a peer reviewer is likely to be a couple of weeks or more, but the time frame is up to the group. Just to review the steps once again, the protocol is revised, approved, and published. Authors write the review. The draft review is submitted by the authors. The draft review is sent out for peer review. You are asked to peer review the systematic review. So again, what happens? The Cochrane Review Group will contact you and ask if you would like to peer review a systematic review. You may or may not have previously provided comments for the protocol of the systematic review, and that is fine. You do not need to have peer reviewed the protocol. If you agree, they will send a review to you and sometimes a checklist, but again, it is not necessary to use a checklist. The systematic review will be different from the protocol in a few ways. Some sections are the same between a protocol and a systematic review. You will need to provide comments about the background, the objectives, and the methods. So consider all the points we mentioned earlier in this presentation when peer reviewing a protocol. However, there will be some important additions in the systematic review. There are new sections that you will need to review since the authors have now conducted the systematic review and reported their results. When providing peer review of a systematic review, you will need to provide comments about how the quality of the studies were assessed. This is typically done by assessing the risk of bias in studies. You will also comment about the results, the conclusions the authors made, and the information included in the abstract, the plain language summary, and the table that summarizes their findings. Of course, there are many details contained in these sections, and it is not expected that you should be able to go into all of the details. We will provide more information in Module 3 about some of these detailed areas. You will also develop more experience over time. However, in general, you should be able to provide some overall comments about the results and how those results might affect how dietitians practice. This is the key reason why your feedback as a dietitian is important. What does a Cochrane systematic review look like? Take this example, Interventions for Preventing Obesity in Children. This systematic review covers the effects of public health interventions. The first part of the systematic review, as we said, is similar to a protocol. However, now we have the abstract of the results, and there is a plain language summary of the results, which is written as a brief summary of the systematic review so that lay people can understand the results. It is important that the abstract, the plain language summary, and the systematic review all have a consistent message and presentation of the results. Unfortunately, this is often not the case. There is a background section, which is typically very similar to the protocol background. There is still the objectives and the methods that the authors wrote in the protocol, which describes the PICO, patient, interventions, comparisons, and outcomes. There will also be information about how the search for studies will be performed and how the results will be statistically analyzed. It is important for peer reviewers to determine if the question and the PICO are important to you and other dietitians. Now the results section is completed, authors must provide a description of all the studies they found. This usually includes information as to how long the studies were, the characteristics of the participants, and what outcomes were measured in the studies. Yes, it is the information that is usually described in the PICO. The authors also need to assess the quality of the studies and the risk of bias in the included studies. This information is so important that there is an entire section devoted to this information. Authors report on the effects of the interventions or results from the studies. The results section can be organized in different ways. Oftentimes it will be organized by intervention versus the comparison. Here are some examples. Dietary education versus control, or physical activity intervention versus control, and then the results from the studies will be presented. Sometimes the results and data are organized by outcome, such as weight, height, blood pressure, mortality. It is up to the author how it is organized, but peer reviewers can comment on whether the way it is organized flows logically and makes sense to the reader. Next, there is a discussion section. This section is similar to any other systematic review or published article. In this section, it is important that the authors tie the results together with the conclusions of the systematic review, along with the level of evidence that they found. This is an important part of the systematic review that peer reviewers will need to read carefully and comment on whether the conclusions follow from the results. Unique to Cochrane systematic reviews is the conclusion section. This section is divided into implications for practice, which reflect how the information in a systematic review can help healthcare professionals make decisions. The second section looks at implications for research, which is another very important section often absent from other systematic reviews. Since the systematic review authors have reviewed all of the evidence, they are often well equipped to write about the gaps in areas of research and are able to point out what research still needs to be done, in what population, in what setting, and measuring what outcomes. As indicated earlier, the discussion and conclusion sections are very important to critically appraise. The most important questions for you to have in mind when reading the conclusions of the systematic review are: what are the results? And how believable are these results? To answer these questions, you will need to consider the results that the author presented and then consider the conclusions they came to in the discussion section. Here are a few examples. Take, for example, a systematic review that compared the effects of school feeding programs or no programs on children. The authors calculated that after 1 year, children who were part of the program gained 0.2 more kilograms in weight than the children who did not have the program. That result was statistically significant. The authors also reported that this information came from 3 studies with 456 children. 2 studies were not well done and therefore at high risk of bias, meaning that there remained a question as to whether the results from the studies were to be believed. The authors also wrote that the largest study had only weighed 60% of the children who were originally in the study. With all of this information, they decided that there was insufficient evidence to make a strong conclusion for school feeding programs. However, in the conclusions section, in the abstract, and in the plain language summary, the authors wrote that school feeding programs improved weight. As a peer reviewer, you could ask yourself that given the author's concern about the risk of bias in the studies, should the authors really write such a conclusion? Or should they be less confident about these results? You would likely ask yourself a couple of questions. How believable are these results? And does the conclusion reflect the results? Without going into details about the statistical analysis, you can think about using your clinical experience and background. You may have heard the expression clinical relevance. In this case, is a 0.2 kilogram difference in weight gain over a year clinically relevant? Is this weight gain meaningful? Even though it is statistically significant, it is likely not clinically significant to make much of a difference. You can also pull from the information that the authors have already provided about the data that contributed to this result. The authors have already said that the studies were at high risk of bias. That is, that the results from the studies may not be true, and they were not able to follow up on many of the children that had been part of the study. Based on what the authors report, the authors likely should not be deciding that there is a strong conclusion that programs improve weight. In this case, you could make the following comment. It is unclear why the authors have concluded that school programs improve weight. They have indicated that the studies were at high risk of bias with loss to follow-up. I also do not think that a 0.2 kilogram weight gain over 1 year in children is a very important result. I would recommend that the authors reconsider their conclusion that programs improve weight. The systematic review also reported on differences in height gain between children who were in the program versus children not in the program. They found that after 1 year, children in the program grew 0.38 centimeters more. But they also found the true effect, also called confidence intervals, could be between 0.32 fewer centimeters for children in the program, or an even greater growth difference of 1.02 centimeters. The authors reported that there was high heterogeneity among the 4 studies, or in other words, inconsistent results across the studies. But again, the authors conclude that school feeding programs improve height. So your comment as a peer reviewer might be, the conclusion that programs improve height does not seem based on the results from the 4 studies. It is also unclear why there was inconsistency among the studies. I think it could be due to a variety of factors, for example, the food, timing, or location of the program. Were the authors able to investigate this, or can they comment on this in their discussion? Let's look at another example. What are the effects of fasting followed by a vegetarian diet in people with rheumatoid arthritis? Pain after 3 weeks. The difference between the groups was 1 point on a scale of 1 to 10. It was lower in the group that fasted and followed the vegetarian diet. Authors report the results came from 1 study with 34 people in it. Authors conclude short-term beneficial effects on pain were found for fasting for 7 to 10 days followed by a vegetarian diet when compared to an ordinary diet. Well, given that there were only 34 people in the study, should the authors have made the conclusion that there are beneficial effects on pain? Your peer review comments might be, the authors have concluded that the diet results in benefits in pain. Given that there were few patients in 1 study, I think this conclusion might be too strong. The next section that is important to peer review is the main conclusion of the systematic review, implications for practice and implications for research. These sections are at the end of the review. It is important to keep in mind that the authors should not be making recommendations. They should not say dietitians should advise patients to eat garlic, but instead point out what dietitians can consider when they decide whether to recommend garlic or not. Again, the implications should match the results of the review and be clearly written so they make sense to the reader. Here's an example from the Implications section of the review. This one is well written. Have a quick glance at this section. You can see that the author describes the types of diets that were included in the systematic review: vegetarian, Mediterranean, etc. They report that the effects are still uncertain, the reason being that there is a high risk of bias in the studies. The authors reviewed the evidence about the main outcomes in the systematic review. They report the possible benefits. They reported what they didn't find. For example, studies did not report on long-term effects. They also point out the potential harms. Under the implications for research, it is key that authors don't just say, "more research needed." They should include more specific details about the type of research that is needed and in whom, where, and what should be measured. Again, this one is well written. However, for the school feeding program review, you may want the authors of the review to consider a couple of points when they write their implications for practice and for research sections. Most studies in that review measured height and weight in children to determine whether the school feeding program worked. You, however, think that BMI is a better measure, and you may also have concerns about whether there should be such an emphasis on weighing children, as this could lead to body image dissatisfaction, self-esteem issues, and possibly an increased risk of eating disorders in this population. So, in your peer review comments, you could write, "For the section about implications for practice, I think the authors should write a comment about the sensitivity of weighing children due to the potential risks of body image dissatisfaction, self-esteem issues, and possibly an increased risk of eating disorders in this population." For the implications for research section, I think it's important that the authors write that BMI should be sensitively measured in future studies. As you can see, these sections can potentially have an impact on practice and future research. What do you do when the systematic review does not find any studies? Sometimes this is called an empty review. The review has all of its sections: background, methods, results, discussion, and implications. But in the results section it says, "We did not find any studies." Oftentimes this review would never be published in any other journal other than the Cochrane Library. Some people would say that this type of review is not valuable enough to be published, but in the Cochrane collaboration there is recognition that these systematic reviews are still important. As an example, the authors did not find any randomized control trials comparing garlic to no garlic to improve diabetes. This means that decision makers or dietitians will need to look at other types of evidence to answer the question. It also means that perhaps someone should submit a proposal to actually conduct a study looking at this question, since it has been identified as an important question that patients are asking dietitians. The authors of the systematic review should clearly describe what type of study should be conducted. As well, you can provide your comments about what that study should include. The authors could describe what other evidence is available to help dietitians make a decision about recommending garlic or not to their clients. The bottom line is, so-called empty reviews are still valuable. As we described previously, there are a lot of different summaries of results in a systematic review. These include abstract, plain language summaries for consumers and patients, and summary of findings tables. The purpose is to present a summary of the results that is easy to read and understandable. The message should be consistent in all three summary presentations. As a peer reviewer, you can comment on the consistency among these sections and whether they are clearly written. Let's go over the peer review process of a systematic review one more time. Similar to the protocol, there is a background, objectives, and methods section that you need to review. The objectives and methods sections should describe the PICO that the author outlined in the protocol, and it is your job as a peer reviewer to decide if the PICO is important to you and other dietitians. In the results section, the author describes the studies they looked at and the outcomes that were measured. You must review this section carefully and comment on whether or not the presentation of results flows logically. Next is the discussion section, where the author ties in the results with the conclusion of the review and the level of evidence they found. It is important that you review this section very carefully to determine if the conclusions that the review has come to correlates with the evidence that is presented in the results. The last part of the review is the conclusion section, where the author discusses how this evidence can affect practice and describes the types of studies that are still needed. It is your job to make sure that the author is not making any recommendations, that the conclusions match the results of the review, and that it makes sense to the reader. Every Cochrane systematic review contains an abstract and a plain language summary. These sections should summarize the main findings of the review in a language that patients and consumers can easily understand. The peer reviewer has to ensure that the abstract, the plain language summary, and the review have a consistent message and presentation of the results. Here's the bottom line. It's up to peer reviewers, dietitians who have the experience in the area, to say whether the conclusions that the systematic review authors make are based on the research evidence that they found and analyzed. You will also be focusing on how this information could affect practice. To summarize the peer review process, the goals of peer review are to improve the review, to ensure the review is about a question that dietitians in practice are asking, a treatment of interest, and outcomes that are important. They also help to ensure that the results and conclusions make sense, and make sure that the review is well written and understandable. Now that you know the basics about how to peer review Cochrane protocols and systematic reviews, how do you become a peer reviewer in the Cochrane collaboration? As I mentioned, there are 53 Cochrane review groups around the world that organize peer review of systematic reviews. Each group focuses on a specific health topic, such as heart, wounds, stroke, upper GI, etc. You can find the list of review groups on the Cochrane Collaboration website under Contact and Review Groups. We would suggest you browse this list and follow the link to the group to read more about what their systematic reviews contain. In this area, you will find not only the link that describes the group focus, but also there is a link to the managing editor of each group. You can email this person to say that you would be willing to peer review protocols and systematic reviews on nutrition-related topics. They certainly will be happy to hear from you, and likely will arrange a system for contacting you whenever a protocol or systematic review in your area is submitted. You then will be on standby. Some review groups have more submissions than others. It could be days, weeks, or months before you are contacted. It will depend on what is submitted. If you are interested in several review group areas or would like to peer review sooner than later, you may want to consider contacting a few review groups. Eileen Villas, the knowledge broker at the Canadian Cochrane Centre, would be pleased to hear from you if you have any questions. She can also put you in contact with a review group or groups based on your interests. We hope that you are encouraged to begin your journey as a peer reviewer. We know that the people in Cochrane will definitely be happy to hear from you. We hope that this module has provided you with some basic skills and that you understand and are feeling more comfortable with the peer review process for the Cochrane collaboration. Of course, once you start peer reviewing, you will continue to learn more and increase your experience and knowledge. We have prepared another module, Module 3, that provides more details about the statistical methods in Cochrane reviews. This should help you to become more familiar with the terms that you will encounter while reading and peer reviewing Cochrane systematic reviews, as well as other types of systematic reviews. We invite you to view that module as well. There is other information available to you that you might find of use. Simply reading Cochrane systematic reviews about nutrition might be helpful to improve understanding about the review structure. You can access them on the Cochrane Library if you have access through your employer or professional organization. And as always, you can visit the official website of the Cochrane Collaboration for more information about Cochrane systematic reviews at www.cochrane.org, or about the specific methods in Cochrane reviews in the Cochrane Handbook, or read a general short description of systematic reviews. Thank you very much for your interest in peer reviewing.